This is probably the best job that I've ever had in my life.
When we were going under the bridges, what our staff would see was unbelievable.
You get to a point where you decide that you really don't want to do this anymore because it's the same thing.
These people are human beings just like the rest of us, and that's where I come in.
These are community people. These are people just like every single one of us who lives in a house.
At the end of the day, you can go home and say you made a difference in the world.
Soul satisfying.
Working with individuals and families experiencing homelessness to develop a housing plan that ultimately leads to a permanent housing is the key goal of the Long Beach Continuum of Care.
A continuum of care is where a bunch of agencies who are all serving the same population come together in a more coordinated way to help work with each other so that we, one, don't duplicate services, and that we ensure that any person experiencing homelessness get the services that are tailored to what their needs are.
The Long Beach Department of Health and Human Services, DHHS, is one of only 4 continuums of care around the nation that are designated as a HUD unified funding agency.
Long Beach is unique in that our continuum had evolved naturally with the multi-service center and agencies that are addressing these issues coming together, but now on a federal level, this name Continuum of Care is something that is happening on all regional levels.
The department allocates funding from HUD to local agencies who provide services in our city. It also coordinates access, engagement, and programming with multiple agencies whose work addresses the impacts of homelessness across the city.
U.S. Vets serves over 550 homeless veterans every single day.
Help Me Help You's mission is to empower homeless by providing them with access to food, access to public benefits, and economic security.
Catholic Charities provides emergency shelter to all homeless persons entering the city of Long Beach in need of shelter.
Our mission is to provide housing and support services, mostly importantly support services, for mentally ill homeless people who have HIV and AIDS.
The joint efforts of the service providers and city departments that are part of the Continuum of Care have led to a dramatic decrease in the number of persons experiencing homelessness in Long Beach.
There's definitely visually that I can see less homeless that I've seen on the streets.
From 2011 to 2017, the total number of homeless persons has dropped almost 40%, while the number of formerly homeless persons in permanent housing has quadrupled.
We are actually at functional zero for our chronically homeless veteran population. So what that means is not that there's 0 homeless veterans on the street, is that we've had the opportunity to offer housing options to all our homeless veterans.
In addition, new innovative service delivery models can be implemented, such as working with the police and fire departments to create quality of life, mental health evaluation, and homeless education and response outreach teams.
On a daily basis, I drive around in a police utility truck filled with supplies, and I make contact with as many homeless people as I can, creating conversations, offering them some basic supplies, and trying to get them connected with the appropriate services for long-term care.
We provide first and foremost medical attention. If they don't have any medical needs, then what we do is we start providing them outreach, try to get them in contact with the City Multi-Service Center or some other agency or organization in town that can better serve their needs.
We definitely work as a team, as a collaborative, to really ensure that our homeless individuals get the resources and the opportunities that they need to get off the street.
One innovative best practice model that has been copied by communities nationwide is the Multi-Service Center.
Unlike other cities, we have this one-stop approach where all the different service providers are located inside the multi-service center.
We work individually, but we also work in concert together, talking, coming up with plans and solutions, and collaborating with one another.
And it made sense to have all those services together and to complement, not duplicate our services, to be able to have our families and the homeless adults that don't live with a family have a place to get clothes, have a place to take a shower, have mental health services there that understand the homeless population.
The more we can work together as a team and as a community to get together and find long-term care for these folks, it's successful because we're treating them like they're people and we're giving them hope where they would otherwise lack it.
Homelessness is a complex issue facing all communities, and with the cost of housing continuing to rise, it is becoming even harder to connect people to permanent housing. But here in Long Beach, we remain committed to working together with all community stakeholders to truly resolve the issue.
They really came out to the public, came out and got me out of a wheelchair, got my health, they promised, my housing, and they make me a dependent person to get back in society. And that's where I'm at now. 6 years later, wouldn't trade it for nothing.
And the most extraordinary thing is I get to see people recover hope. I get to see veterans, and I'm a veteran myself. I get to help the men and women that served our country to recover their dignity and to recover hope and homes.
It's reaching out a hand to say, look, we're going to help you learn how to help yourself.
I can't tell you what it's like to see somebody who has been living under a freeway and actually get them into an apartment and get them healthy and get them sober and get them mentally fit to go back into the workforce. We have some extraordinary clients who are doing some extraordinary things today, and it's incredibly grateful, incredibly powerful people to help them.